Hi, Dave. Good morning to you. Well, I feel in my element this morning because, fun fact, for 3 years of college, I was actually a physical therapy student before switching over to broadcast. So I know what some of these students are going through this morning. And this is really, really neat here at the University of St. Augustine. It is a real-time clinical setting where students can kind of get that real-world experience they need before they actually head out to respective jobs. And joining us, we have Dr. Amy Walters this morning. She is an instructor here. Good morning to you. Thanks for being here with us.
Yeah.
Now, October marks National Physical Therapy Month. So
Absolutely.
What a better way to talk about this? And we do have some PT students with us this morning.
Absolutely. They got up bright and early to come out here.
Tell us a little bit about this center and what it means for these students.
So this is the Center of Innovative Clinical Practice, and we're super excited about this. We just got it about a year ago. And what it is it's a place where we can give the students a more realistic experience. It's hard when you're in a classroom and you just have a table and you're trying to pretend a 20-year-old has an illness and act out these scenarios. It's just not very realistic. So we can bring them in here. They have a hospital bed. They have IV poles, wheelchairs. We can really make it a lot more realistic. That really creates kind of this emotional response and then really sticks with them a lot more than just working in the classroom.
Yeah.
And the other piece of it is, this is a safe place for them to make mistakes. So what they can do is come here, make the mistakes, and learn from them before they go out on internship.
Sure, that's a great way to put it. Any job, any new career that you get into, there is room for making those mistakes, and this is the area in which you can do so. What are some of the situations students might find themselves in this clinical setting?
So this is supposed to be, we have different rooms in the CICP is what we call it for short, and we have some that are supposed to simulate like an outpatient center. This one is supposed to be more of a hospital setting. So this might be one of your patients who comes in to get a knee replacement, and then you're the one that comes in a few hours later and you're getting them up and walking with them.
Great.
Might be patients. We have another room that simulates an ICU setting. So then you can, practice moving patients around with all these lines and tubes connected to them. And then that's going to give them a more realistic portrait of how it's going to be to work with a patient that's attached to a line.
Now, several of these students will be graduating here soon. What's the feedback that they've been able to give in being part of this clinical setting?
They've been really excited about it. We have some students that are just about to graduate and in literally a few weeks, and then this other group is actually about to go out on their internship. So the feedback we've had is they do feel more prepared. They're more comfortable in the hospital settings because they've worked with these beds. They've actually raised and lowered the beds. They've raised and lowered the rails on it. All of that is just going to add a little element of comfort because they felt like they've been in that setting.
Fantastic. Well, a lot of great information. This is really a neat setting that we've kind of been able to get a sneak peek of this morning. Dr. Walters, thank you so much for joining us.
Thank you.
All right, and coming up during the 8 o'clock hour, I'm going to actually become a patient and see what these students will be able to do with these real-world situations with me. We're going to talk a little bit about my gait and how we can assess that. For now, we're going to send it back to you in the studio.
8:07 right now. It is National Physical Therapy Month, and the University of St. Augustine opened a brand new training facility to aid health science students on campus. This morning, we're getting a look at all that new technology. Jane Lonsdale is live there with more. Good morning, Jane.
Hi, Amanda. Good morning to you. Yes, we are at the Center for Innovative Clinical Practice here at the University of St. Augustine, and I have now become a patient. So I'm surrounded by some of the physical therapy students. Some are going off into an internship, and some are graduating here soon. But this is what they would see in the learning setting here at the university. And joining me, I have Dr. Amy Walters here. She's an instructor with the students. All right, tell us about this center and what students go through each day here.
Yeah, so this is an example of a simulation that we might do with our students. And we have Tara and Dion, who are two of our 6th trimester students. So they're just about to head out on their internship. So they're done with their classwork and they're about to go out into the clinic. So what we can do is we can give them scenarios that they might see out in the clinic and have them practice before they have a real patient. stakes are
Yeah,
higher.
absolutely. What are some of the typical scenarios that some of these students might encounter?
So the one we're going to do now is going to be an example of a patient that's had a total knee replacement. And what happens with these patients is now, we've learned you have to get people moving as soon as possible. So you might have had surgery this morning, just a few hours ago, and then they're going to come in the afternoon and they're going to get you up and get you walking. So they need to know, how do you process your anesthetic? How are you doing with your medications? Are there any nerve blocks worn off? They need to be able to guard you and then teach you how to walk so that you can go home as quickly as possible.
Now, you have actors that actually come in and really get into the role of whatever patient that they're trying to play and portray so that these students do get that real world experience.
Right. We start them out practicing on each other, and then we'll bring in maybe some staff, faculty, family members, and then we can actually bring in actors from the community. And what's great about that is we can really see how they do with their communication, because if you're speaking to another student, you can use a language that you've learned in school and they understand it. But when you're talking to a patient, you can't say, I'm going to flex your leg, I'm going to roll you, I'm going to go from supine to sitting and gait train you. They don't know what those words mean. And so it's really important to teach them to communicate in that patient-friendly language. And this is a good way to do that.
Very good. So I have had a total knee replacement.
Absolutely.
Just got done with surgery here this morning. So walk me through what these students are going to kind of do with me as the patient here this morning.
So they're going to come in, they have to introduce themselves, make sure they have the right patient, very important. And then what they're going to do is they're going to get you out of bed. So we call that bed mobility. So they're going to help you support that leg, get you sitting up at the side of the bed, might check your vital signs to see how you're doing. They're going to see how you're recovering from your anesthetic. And then what they're going to do is maybe transfer you into a chair. They might do some exercises. What we're going to do today is actually get you up and have them gait.
Let's do it.
So
hi, I'm Tara. I'm a student physical therapist here to work with you today.
Okay.
What Deanna and I are going to try and do is we're going to get you up and moving with this walker, and he's going to follow behind with the wheelchair in case you get tired.
All right, fantastic.
Sounds okay? All right, so what we're going to do is let's move this IV line.
Perfect. And this is where this is great, because what we can do is they actually get to experience moving these bed rails, moving these IV lines.
Sure, because you might have the IV that's connected.
Absolutely.
Okay, so what you're going to do, since you're able to sit up, if you want to support yourself, we're going to help you move this leg, because I know that might be a little painful.
Yeah, for sure.
And then we'll move this one around as well.
All right.
Okay?
So the goal here is basically for you to move your leg as much as you can yourself.
Okay.
Wait.
All right.
And
then we'll set you down so you can...
So, yeah, we'll go just like that. But it would.
Not exactly. I haven't had the actual total knee replacement surgery.
So normally we would have you sitting like just to the edge of the bed, and then we're going to put a gait belt on you.
Yeah, if you want to sit back down.
So if you want to sit back down, and we'll kind of teach you how we would do this with a...
All right, so we've got that gait belt that would go on, and we're running out of time here, so tell us a little bit about the center and where you're located.
So we're at the University of St Augustine, and we're actually tucked away into the Circle C neighborhood, so a lot of people don't even know we're here yet, but we've actually been here since about 2011, 2012.
All right, very good. Yeah, so we would get that gait belt on, and they would kind of use the walker.
Absolutely, and then they'd get you up and make sure that you're safe to walk, and the sooner we get you moving, the sooner we get you home.
Really important.
Really important.
Thank you for all that information and for kind of doing that simulation with me. I really appreciate it. All right, guys, October National Therapy Month, as we mentioned, and we're going to get a look at the driving simulator experience coming up during the 9 o'clock hour, so stay tuned for that. For now, we're going to send it back to you in the studio.
All right, scared Shields.
I know.
Thought you were hurt there.
I was like, man.
I just had
Getting out there and she blew out her knee. I'm like, whoa.
What are the odds going out there to talk about...
It is National Physical Therapy. The University of St. Augustine opened a brand new training facility to help health science students on campus. We're going to look at all the new technology this morning. Jane Lonsdale is live on campus with the story. Good morning, Jane.
Hi, Amanda. Good morning to you. All right, right now we are getting a driver-simulated rehab experience. It's pretty neat. This is the newest technology here at the University of St. Augustine. Some cool stuff. And I have Dr. Geraldine Callan joining us this morning to tell us a little bit more about this. Hello to you. Good morning.
Good morning. morning.
All right, so what type of patient would we have sitting here inside this simulator, kind of going through this driving experience?
Many times we have patients who have had neurological illness or injury, and those are the patients that we predominantly see. We also oftentimes have geriatric patients who are concerned about whether or not they're safe to drive, and we can do both assessment and evaluation and rehab if it's indicated.
Now, we know a lot of times with neurological issues and things, that's an occupational therapist works, but can also work hand in hand with physical therapy students as well.
Absolutely. We take great pride here at the University of St. Augustine in having our students work with all the disciplines together, because in the real world that's who they're working with day in and day out. So we oftentimes give our students the opportunity to work with each other on cases. Maybe you have a neurologically based client, but they also have a broken hip.
Sure.
So physical therapy might be working on strengthening that leg to push the gas pedal, while occupational therapy is working on the neurological concepts behind driving and keeping them safe.
All right, we ready to give this a whirlwind roll here?
Absolutely. Let's get started.
We'll buckle up.
Yes, this is just like a real car.
Okay.
And so you have to buckle up for safety.
All right.
Go ahead and put your foot on the brake.
Okay.
And you're going to put your emergency brake down. And go ahead and pull that lever back into drive. And you're ready to go.
All right. I'm going to check our mirrors here. It's raining here in Austin. We'll pretend that this is Austin. All right, here we go. And what are you kind of looking for as a patient goes through this?
Especially when we're doing evaluation, we're looking to see, are they checking their mirrors? Are they utilizing their turn signals? Are they giving themselves enough distance and space? Are they speeding? Are they going too slow? Generally just doing lots of observations about their abilities and kind of how they navigate the environment that is definitely new to them. In many of the ways that you would see on the road. So as you can tell, it's raining right now. This simulator has the ability to simulate snow and ice and sunshine and fog. We have city driving, country driving. We have a track. We have lots of different options.
This simulator actually moves with the patient as well, so you can really feel what's going on, and it's a little bit more tough than it looks, honestly.
It's a lot of fun. Students really have a great time with it.
Oh, yeah.
We utilize it across our curriculum, and we're still developing our programs to include this driving simulator as much as we can so that all the students have the benefit of it.
No, this is really, really neat. So you kind of get a report card after you finish the experience,
You
right?
do. It'll tell you if you were too close, if you were speeding, if you were going too slow, if you hit anyone, if you ran a red light, if and so it's nice. You can also set it to tell you that it's doing it while you do it.
Okay.
So there's lots of different options, so many settings on this. This is really a top-of-the-line simulator. It's the best one that's available on the market right now.
This is really a neat opportunity for students to kind of, be able to assess their patients and kind of what's going on. Ooh, we got to stop there. Excellent. Well, thank you so much for showing this to us. It really is a neat piece of technology and an opportunity for a lot of learning to be had.
Absolutely. Thank you for coming out today.
All right. It's been a lot of fun, guys. Great driving experience. A lot learned here this morning throughout the entire morning. So we're going to send it back to you now in the studio.
Some nice driving there.
Yeah. A+.
All right, well,
Good job, Dane.
Her knee's all better.
That's right. Her knees